Hi, everyone, and welcome to Getting to the Root Cause with Dr. Fong. Today, I'm very excited because I have an expert in PTSD and trauma, and her name is Joelle Rabow Maletis. And we are talking about a topic that's really important to me and in my clinical practice because I deal with trauma and PTSD and the emotional aspects of healing so much in my practice. Joelle is a well-known psychologist and psychotherapist, and she is an expert in these fields in military psychology, trauma, and PTSD. She is an author and educator through TED Talk, an associate producer of the Repressive video, and she has been featured in the Lasting app, Talkspace, a guest expert on ABC with Cheryl Jennings. She did a special report on eating disorders and body image, and I'm just so excited to talk today because this is a topic I have been wanting to cover in my podcast for a long time now, and I'm so happy that we were able to connect and talk about this really important subject. So I would love to just kind of get a little snippet of what do you do and tell us a little bit about your practice, and then we will kind of get started on talking about PTSD and trauma.
Sounds great. Thanks so much for having me. It's been an honor, and I'm really excited to have this conversation with you. A little bit about me. So I run a clinic, and I have a fantastic clinical staff, and everyone is trained in trauma-informed therapy. And so most of the people that we work with are coming in, whether they're trying to identify if they have trauma. You know, some clients have significant trauma, other clients have PTSD diagnoses. And so we really specialize in that. And what we find is that so many people with trauma have underlying issues. They have health issues. As you know, in your practice, you've seen that a lot, right? Where there's these comorbid diagnoses and they have anxiety or depressive symptoms, and they're just looking for a place. And so we provide more of a solution-focused, skills-based practice that's holistic, this mind, body, spirit approach to working with trauma that's really tailor-made for our clients.
And then I know in your practice, you know, there's a focus on supporting veterans and military psychology. Tell me how that developed.
I was an intern. I was working at a hospital in the inpatient unit, and part of the rotation was working in the ED and taking in patients and doing assessments, and had somebody that came in with pretty severe psychosis and PTSD, who was an active duty military member, and that piqued my interest. I come from a military family, so the kind of ethos and personality made sense to me. And I really just fell into it. I was already considered a trauma expert at the time because of all of the other work I had done with eating disorders, and my dissertation was working with eating disorders, PTSD specifically, and addiction. And so the population made sense, and it was before really military psychology was a thing. It's almost like I found my people in some ways. And so I have such a weird practice. I have this diverse group of people, whether it's C-suite, Google, Apple, Netflix people. I still work with dancers and eating disorders, which I equally love. And then I work with military. I'm one of very few in California that works with special forces, special operations teams. And so I have this very, niche group of people. And just looking at, okay, what does trauma look like for them and for the veteran community? Of course, their experiences are traumatic, but does that mean disordered, right? Is it that they've had trauma, they need to learn how to process trauma and reintegrate? That doesn't necessarily mean that they're broken, right? Or that there's a huge disordered where daily life and living changes because of it. And so part of it was, okay, how do we reintegrate what we've experienced as trauma into our daily life and living where it's not causing us to have these disordered experiences? And so trying to normalize that for people a little bit.
And tell us a little bit about that process, because I think maybe some of the listeners are listening. Okay, great. Like you work with trauma and eating disorders and the traumas from being in the military, but how? How do you do that? And I think that's a really interesting answer. And I know there's probably different therapies you use. So maybe if you could walk us through what it would look like if, someone walked into your office, and how would you walk them through normalizing that, making those traumas less triggering? How does that actually work?
Yeah, again, a great question. And so I always start with backing into the answer. And so, first and foremost, for people that are listening, right, find somebody you like, interview a therapist or two or three, find that right connection. Sometimes that's more important than the modality of being able to just find the person that you're willing to trust. Therapy isn't fun and it's not easy. And it's painful at times. And so when you have that other person there that can support you through the process, that helps. Having said that, if you're interested in therapy for trauma specifically, you're looking for somebody who's a trauma-informed therapist. And so what that means is they've had a lot of training in working with some kind of modality with trauma. So there's a lot of different ones. In my practice, I use a bunch of different things because I really create a treatment model per client. So it's not always the same. And it's things that are skills-based, like cognitive behavioral thought or CBT or DBT, dialectical behavior theory. And I can tell you the difference between those two. And then, which is a very skills-based practice, something that is called solution-focused therapy, which is that and so what part. So what's the solutions here, right? And not so what, who cares, but what do we do with this? How do we want to resolve this? How do we want to show up and be present? And so these are more linear models. It's, very systematic. A plus B equals C. There's a skill set that we use. There's a mindfulness component that we use with breath work, calming the body. And so that's one approach. There's another approach that's somatic-based therapies, which is body-based therapies. And so that can be everything from craniosacral. It can be from doing, body work, which typically most practitioners or most therapists don't use. There are somatic-based therapists. And so a lot of that is where do you feel it in the body? So at times when I'm talking to people, my hand will come to my chest and it's like, I'm feeling heavy. I wonder if that's how you're feeling, right? Or can you tell me how you're feeling that in your body? It's like, yeah, my head hurts, or I'm nauseous right now, or I feel heavy. And so the somatic is, how does the body hold the memory? Because the body holds the trauma, and so how is the body going to process that? So that's another type of trauma work. And then there's something that we have that's what we call prolonged exposure therapy, or PE. It's a CBT approach. So it's a very skills-based approach. It's not people's favorite. It's not my favorite. It causes somebody to relive and re-experience the trauma over and over and over until they have been systematically desensitized to it. So that's a different approach. And then there's EMDR, which you and I, I know we share a love with that. And EMDR is more about taking it from a holistic level. It's how is the body holding the trauma? How is the brain interpreting or not interpreting the trauma? And then through bilateral stimulation, using a different, whether we use light, we use touch, we use tapping, some people use auditory, right? Through that bilateral stimulation of this rapid eye movement process or reprocessing, can we reintegrate the trauma? And it's very effective. So that kind of gives you an idea of what trauma-informed therapy looks like, and why one works over the other is really client-centered. It's what somebody brings to me. So a lot of times my clients are coming in and they've done a lot of therapy. They might have done EMDR before, or they've done cognitive reprocessing therapies, and they're stuck. Or it's just coming up again. So it was successful then, and now 2 or 3 years later, they've hit another glitch. Usually looking at, okay, what have you done? Let's talk about how therapy has worked for you, what's worked for you, what hasn't, and then can I create a program that is going to work?
So basically, you do an assessment with the client and you say, okay, let me figure out what's the best treatment modality for you. And you might use a number of different trauma treatments or modalities to kind of help the patient to normalize it, reprocess it, et cetera. But they shouldn't necessarily be looking for any one person that does only EMDR or only this or only that, but a trauma-informed therapist is someone they should be looking for.
Yeah, and sometimes people, like for example, your patients will come to you and you're like, hey, I think you really need to do on mindfulness with yoga and breath work and skills-based DBT, right? Or you might say, no, you're a really good candidate for EMDR. So sometimes people are coming in with, this is what I want to do.
Mm-hmm.
I'm a big believer that, any response in therapy and psychotherapy is important. So if you say to me, hey, Joe, that worked really great. I'm like, cool, let's keep doing it. Right.
Yeah. Yeah.
And if you come back the next week and you're like, that was terrible. I don't like to read. I don't want to do homework. I don't, that wasn't helpful at all. I'm like, okay, cool, wrong approach. Right. I mean, that's not personal. It's just, okay, this is not the right approach. We're not going to get to the place that the client wants to get to with that. So a lot of times in the first few sessions, it's sort of this feeling out of, hey, try this thing and let me know what you think. When somebody's resistant, they come back and they're like, I'm not doing that, right? And they have this level of resistance. I usually go, okay, there's something there, right? There's something more there we need to tease out. And that's why I start off this answering this question with, find somebody you trust.
And it's kind of the same even with my patients. I tell them we're going on a journey together, and I in my practice as well too, I have like hundreds of modalities that I could potentially use, and to list them off would be numerous, just like you. And it's a matter of finding out which one is the right one for that patient. And it's going to change and move as we go through the process. And the most important thing is that we're connected and we have a really great relationship and there's trust. And so I agree with you. And I also tell new patients, I say, interview a lot of different naturopathic doctors so that you can find the one that really connects with you and has the same philosophy that you are trying to approach your healing towards. So yeah, I think that's a great thing to suggest to the listeners. The other thing that I think is really interesting is I think some people have trauma and don't know they have trauma, and they get triggered and they have daily stress and weekly stress and monthly stress, and it's actually getting triggered by traumas that they don't even realize. And so what I like to tell my patients is, when you're a little kid and you see a hot stove, you don't know it's hot yet. So you touch the hot stove and then all of a sudden you're like, oh my gosh, it's hot. And you pull your hand back. And when you see it again and you connect that, oh, wait a second, that might be hot, you might actually respond without actually consciously thinking about that. You subconsciously or unconsciously respond. And I tell people that can actually happen in regards to emotions and other things that happen in your daily life. So I think a really good example was me when I kind of uncovered through another type of therapy I really like to do in my practice is emotion code. And that revealed to me that one of my traumas was when my little sister was born, which to the outside world doesn't feel like a trauma, right? It's like, okay, your sister was born, big deal. But to me, my mom started giving her a lot of love and it felt like abandonment to me. And when I identified that, it really, I started to look at my life and say, oh, okay, so now I kind of understand a couple things and how I get triggered sometimes with abandonment when I wasn't really abandoned, right? Like my sister was just born. It seems pretty, trivial, but it was an actual mini trauma to me that I like to work with my patients and identify. And so do you also work with those types of things, not like outright trauma where it's like, okay, something definitely big happened, but how do you feel about those little tiny traumas that occur and we get triggered by those?
Yeah, I love that you bring that up. And it's such a poignant example because, two things happen. One is it doesn't have to be traumatic to me, right? If it's traumatic to the client, it's trauma, right? And so I don't think that there's these, trivial types of things or little traumas. We used to, and I say we as in the world of psychology, pre 2014 would say, well, there's these big T traumas and these little T traumas. And that's demeaning in some way, right? Because it's putting me in a position as the therapist to say, okay, let me decide what's traumatic. And I don't see it that way, right? If it's traumatic to you, it's traumatic, right? And a lot of times people come in exactly with what you said, and they're like, there's this thing, right? But I don't think that that's trauma. It's like, well, how are you responding to that? Like, clearly it's bothering you.
Right.
So let's talk about that, right? Because if it feels traumatic, chances are it's traumatic. And that's really different than dramatic, right? And people, I think, sometimes have a hard time distinguishing if they're being overly dramatic, right? Or if it's this thing that happened that is, for whatever reason, bugging them. And it could be as simple as, like you said, there are some triggers that were happening from that. And then you figured out, oh, here's how these connection points happened for me and why I think the way I think now, right? And that is the same process as somebody who's witnessed something horrific, who's experienced something horrific, right? And it's the same thing. They're like, this thing happened to me and this is how it's affecting me. It's just a different scale, right? Not better or worse, just a different, it's just scaled differently. And so for me, I think that that's fundamentally important, where I'm not the one to sit in judgment, right? If you come in and you say, hey, I think I was traumatized, or this thing feels traumatic. Okay, let's talk about that.
Absolutely.
It's PTSD. And that's my point, right? Is we experience traumatic stress all the time. If anyone who's listening has just lived through COVID, they lived through political unrest, regardless of where they fall on either side of that, right? They've lived through these things. They've lived through horrific news stories with, things that were happening with the rise of different, BIPOC movements, right? These things are traumatic, and witnessing them, watching it on TV is traumatic, right? Some people, it doesn't affect them. Other people, it affects them greatly.
I'm glad you brought that up, because that has come up so much in my practice in the last year. And I do feel that people's physical symptoms, physical body, it is showing symptoms because of these trauma experiences that everyone's having. And that's an interesting thing. And I think you brought that up earlier, is the somatic experience that happens, which means that you might emotionally feel something, but your physical body actually shows those symptoms. And in my practice, that is a lot of what I do with patients. And on my first discovery consult, I usually say, do you think there's anything emotionally we need to work through? And oftentimes people say yes, like everybody says yes, right? Yeah. And we know it, but I don't think we're used to our doctors asking us about that. We're used to going to our therapist and saying, okay, we have these emotional issues, but separating that from the whole physical piece, which bothers me so much, because I'm like, you cannot separate them. They are one and the same. It's one person, one body. Holistically, they work together. So what have you seen in terms of the emotional space affecting the physical body?
Sometimes people who haven't had physical trauma have a much easier time being in their body and identifying, like, oh, when I fight with my partner, I get nauseous, or when I see this thing, it gives me a headache, or my back hurts, when I'm overly agitated or stressed out, right? They have a much easier time identifying those components, right? It's part of why I love having clients see you, because, it really is a team approach, right? Of like, hey, this is happening in your body. When people have had a lot of physical trauma, they're dissociated, right? They're out of body. And so people report, they feel like they're living in a movie, or they feel like they're hovering in the corner and they're watching themselves, but they're completely detached from what they physically feel. And so it's much harder for them to identify what's happening in the body. And clearly the body is having a major traumatic response if it's causing, the persona, right, or the ethos, that emotional content, to pull away from any kind of physical, effect. And so it's hard, because a lot of times, I'm asking the same questions, what's going on with you medically? Are you taking any medications? What have you been diagnosed with? When was the last time you had a physical? Because all of those things are important. And so I really do think that the mind-body connection is not what Western psychology is, where it's like we have the mind and then we have the body. And we know that they interconnect, but I don't really believe that. I think that no, there's a totality of who we are. And I'd like to use, especially in the beginning, the idea of a bicycle wheel, And it's like, okay, imagine all these different spokes on a bicycle wheel, and those are all the different facets of who you are, what you do, where you come from, how you identify, all these different things, right? What you do for a job, are you a parent, all these different bicycle spokes. And a few of them are always bent because we're not perfect. But when they break, then we start to get out of balance. And after a while, the wheel doesn't function so well. And so I tend to look at it from like that approach of, tell me all of these different parts about you, right? Tell me a little bit more about your background. And I ask, do you feel like you float? Do you feel numb? Do you feel like you're watching yourself? Because I'm trying to get a sense of, is somebody in their body or are they out of body? When they're out of body, right, it's much harder work to get them to identify, this is where I'm feeling it.
Well, I think it's really interesting. In my opinion, man, woman, child, old, young, it doesn't matter. I always address some part of the emotional space with all of my patients. So they could be coming in for eczema, they could be coming in for constipation. And oftentimes there is some emotional, I call them trapped emotions or, traumas even that are either people know about them or they don't know about them that we need to identify. And sometimes they need that extra work with someone like yourself. And sometimes they just kind of need to know that it's actually just there, that it's something we need to pay attention to, right? So I think sometimes we just don't even know that actually has to do with our physical symptoms. And I think it's really interesting. And when I see patients and we work only on the physical aspect first, or I send them to someone like yourself to work only on the emotional aspect, and they come back and like their symptoms are 50 to 100% better. It's like, wow, okay. So that was like everything. That was everything that was causing your physical symptoms. And there's so many physical reasons for that, such as your adrenals being taxed and then your hormones being off balanced and your body being in fight or flight and now not being able to do all of the parasympathetic normal processes your body's supposed to do. So the next thing I really want to talk about is, how can listeners identify that they need to be reaching out to someone like you? Because I think some people are going through things in their life, and I know that one of my friends, we had lunch one day and I told her, I think it would be really helpful if you saw a therapist. And she was like, nothing's wrong with me. I don't need that. I'm not crazy and I don't need help. And I told her, I said, I think if everybody saw a therapist, our world would be a much better place. And I feel like it doesn't have to be like something big happened to you, someone died in your life, or you had all this trauma. I really think that if all of us just had a therapist as part of our insurance policy, I think that the world would be so much of a better place, because we would have the space and the time to talk and share our experiences and really kind of figure out, okay, why did I do that? How do I make it better, et cetera. So tell me a little bit about, like, how does someone determine that, okay, it might be a good idea to talk to someone like yourself?
Yeah, I totally agree with you. And I'm laughing because I did an interview earlier in the week, and the interviewer asked me a similar question. And I said, there are so many times where I have said, if nothing else, I have the luxury of going to therapy once a week. And if I don't have anything to talk to you that day, which usually means that I don't want to talk, but I have two, I have two children at university, right? And I'm like, even if I go in and complain about my kids for an hour, I always walk out and I don't want to say I feel better, because like I said, therapy isn't fun all the time, right?
Right.
But I feel lighter. It's like,
Yeah.
that person's not going to judge me. Whatever I say about my children, as much as I adore them, they drive me bananas, right? And so whatever I say about them is confidential. I know that person's not going to share anything I said, and I can just go and vomit information for an hour and then leave. And I don't think about, and I can't deal with my girlfriends all the time. Sometimes.
Right.
After a while, my friends are like, really? Like, I'm so over here. Like, can you?
Right. Exactly.
I think from that perspective, people are afraid to go to therapy because we fear the unknown, right? And it's scary. And there's nothing worse than feeling judged by someone. And that's why it just keeps coming back to find the right person.
Right.
To answer your question too, as far as when do you know if you should go, some of it is that our friends and family can only deal with so much. One, two, they are always going to be on our side. And your really close friends will say, maybe you should, or, they might give us a little snippet of the truth, right? But they're always going to be on our side. And that's why they're our friends. The therapist isn't your friend, and they don't have any positive or negative gains of telling you the truth, right? It doesn't make them get anything more out of it, right? It's so a lot of times the therapist is holding up a mirror going, okay, really? Is this really how you want to be? Right?
Yeah.
And because I work with such a unique population who have very colorful language and don't really want to talk about feelings, a lot of times I'm sarcastic and I'll say, so how's that working for you? How'd that work for you? And it's like, oh, it was terrible, this thing. And then we can go somewhere.
Yeah.
So I think, a lot of it is if somebody's skeptical, do an interview, call around, find somebody you think you might want to talk to and ask them what they think. If it feels terrible, don't do it. Right. But I do put it in this camp as I think it's a luxury. And if we could destigmatize it, because it really isn't about crazy, right? It isn't about there's something wrong with me. It really is about growth and self-reflection of being able to say, here's what's happening in my life today. And there are parts of it that I love. And then there are parts of it that I'm not doing well. And then, and I need to talk through what I'm not doing well.
Absolutely. I think that's great advice. And I think that, again, I think every listener should consider even just a couple sessions of just talking to someone and piecing together some of the things that maybe just feel like they need to be talked out with someone who is unbiased, who will tell you the truth, who has no gain in it or anything, and I think that is the difference. And that's wonderful. What would you suggest for people who are listening and they're saying, okay, yes, I think that might be something I want to do, but maybe they don't have the finances or the insurance or et cetera. What can they do in their lives right now? What are some suggestions that you might make, books they might read, things they might do in their daily life, people they might reach out to, even resources, what would you suggest?
Great question. So there's a lot of resources. If people have insurance, looking on your insurance website for providers will give you a list of people. There's a search engine called Psychology Today that you can actually put in if you're looking for a male or female therapist, if you're looking for somebody who specializes in LGBTQ issues, whatever insurance you have. So you can specify through the search engine your zip code, and it'll give you all of the therapists, in that area. So there's something like that. Locally, if people are in the Bay Area, and this is actually true for most places in California, I don't know about other states, but all of the teaching universities that have PhD or PsyD programs, or they have marriage and family therapy, counseling, psychology programs, actually work with a counseling center. And so if you are willing to see an intern or somebody who's in school, sometimes that therapy is $5, and they have sliding scales. So locally, Palo Alto University in Los Altos has the Gronowski Clinic, and I believe it's $25 a session.
Right.
And you're working with people who are finishing up their PhD or PsyD. It is a fantastic program. So there's a lot of things, like UCSF has a program, Golden Gate University has a program where they have counseling centers, and so you can get virtually free therapy. So those are some options. I have strong opinions about the text to therapist, and this is sort of this new phenomenon we're seeing come up.
Yeah.
And I don't know if I want to say more about that other than I have strong, it's an option. It's better than nothing. There are so many hotlines. There are anxiety hotlines, suicide hotlines, LGBT hotline. Like there's so many hotlines where you can talk to somebody if you're really, if someone's feeling really agitated or they're really struggling, right? Amazon has a plethora of self-help books. And my 2 cents on that is, see what the consumer reviews are, because that'll give you a good indication of what other people liked. Listen to it on Audible. And the reason I suggest, or Kindle, the reason I suggest listen to it is this is not a subject that you want to sit down and go, okay, I'm going to, listen to this for 3 hours. People tend to flood themselves and get completely overwhelmed. And then those physical symptoms happen, right? Their body floods with cortisol and adrenaline and dope, and then they're spun, right? So listen to it and give yourself 30 minutes. Like, I'm going to go out and take a walk and listen to this thing for, just 30 minutes. And then I'm going to put it away. And then I'll do it again, maybe later or again tomorrow. So it's small snippets where it's manageable. And it's not, if people do have trauma, it's not re-triggering. And the other thing Amazon has that's fantastic are workbooks. And they have a ton of workbooks. And a lot of them are really good. They aren't very expensive. Usually they're under $20. And so if someone has the financial resources to buy a workbook and they don't like it, it's not this huge expense. So there's lots of things out there. I want to advise people though, to be very wary. Reading people's Instas, Reddit posts, that's not therapy. It's great information. And there's a lot of great information out there. Right? But being mindful that information is not necessarily therapy, and information's a great way to start. Let me look up this thing. What's going on? What do I think it is?
Those are some really great suggestions. Are there any particular books that kind of pop up in mind that people should look up and maybe just kind of look at the reviews and see if the summary piques their interest? Is there anything that is off the top of your head?
Yeah, I'm a DBT kind of person, and dialectical behavior therapy marries this Western psychology of skills, and so what, if this happens, then that happens, something we call thought stopping. Visualize a stop sign, tell yourself to stop, take a breath. And so it uses skills-based, and then it weaves in this Eastern philosophy about meditation, mindfulness, and breath work. And so a lot of times it's putting the two together. Okay, stop, take a big breath, roll your shoulders, right? Get yourself centered, try and do some grounding, right? And then we're going to work through this skill. And so it's a marrying of these two different concepts. And so the person that has there's some really good stuff. Marsha Linehan wrote the theory in the 70s, and she wrote it specifically for borderline personality disorder. And come by the 80s, only 10 years later, it was such a well-respected therapy model that it's used for everything now, and it is one of the gold standards of therapy. Okay. And so Linehan's stuff is really hard to read. She's a researcher and she writes for PhDs, and it's hard to read. So one of her students is Matthew McKay. I want to say he's out of Berkeley, but don't hold me to that. But he has a lot of stuff, and he has a lot of different approaches, and everything he has is accessible on Amazon. And he has a lot of workbooks. He has things on trauma, on anxiety, self-esteem. And so I really like McKay's work. I think it's solid, it's user-friendly, it's easy to understand. It's chunked, so it's only, chapters are only a few pages. So it's you can sit down and say, okay, I'm going to do a page a day, or I'm going to do a page a week, and it's got a nice flow. I like that. And I can never pronounce his name. You probably can help me out. I want to say it's Vander something, but the book is The Body Keeps the Score, and that's a gold standard in working with somatic work. Peter Levine is another. Dr. Peter Levine wrote a book called Waking the Tiger. He's since written several. That's more about somatic body work. So there's good stuff out there.
Okay. Yeah, those are great. I love the skills-based stuff that you're saying. And I think that stuff is so important, because the things that you can do when you're triggered, and the things that you can just, stop, and the stop sign. I love all of that. So I think those are really great tools. And I love to give my patients those tools, because just saying, okay, let's talk about it, and that's it, without giving any skills, I think the skills make it easier to accomplish and tackle those things. So that's great.
It's, as I said, it's one approach. Psychodynamic talk therapy, where is more traditional therapy. A client comes in, they talk, the therapist really listens, and they don't necessarily interject their opinion. Sometimes they'll ask questions, right? Sometimes they'll sit in silence. It's an older model of therapy. It's still, we use it all the time, and it's true blue, right? Certain people really like that.
Yeah.
I have plenty of clients that come in and they're like, I'm not doing a worksheet. I'm not going to read anything. I don't want to do homework. It's like, okay, let me teach you the skill here, and then you're going to go practice it. And when I see you in 7 days, we'll see how it went, right?
Right.
So there's always a place for that psychodynamic talk therapy. I think it's really important, because like I said, I don't believe that there's a one modality fits all, for everybody.
Yeah. Okay, well, those are some great tools. This has been such a fun conversation. Fun for me because I love this topic, because I just think it's something that is not talked about a lot, especially when it comes to just physical disease. We don't ever correlate it with that. So that's my interest in it. But even apart from that, just the whole trauma, and where can people find help? I hope that we've given you guys some tools today, so that you can, either do your own work, go on Amazon, buy these books, or reach out to someone. I think finding someone who's a student and the local universities, I think that's a great idea as well too. First of all, do you see people who aren't local to you? Because a lot of our listeners are not necessarily local to the Bay Area, which is where both Joelle and I work out of. Do you see people in other locations?
So we see people throughout California. I'm licensed in Texas and several other states. And then I do a lot of coaching. So people they can find me on Instagram. It's just my name. They can email me. And I'm, even if it's an email of, hey, I heard you on this podcast. What do you think I need? I'm happy to respond to emails and try and point people to good clinicians. There are a lot of really great clinicians out there. And there's some not so great clinicians. So it's finding somebody that's going to fit.
Yeah.
For sure.
Okay, great. And I know you mentioned that you wanted to offer a special gift to the listeners who are coming to this podcast and hearing you. So what was that special gift?
Yeah, that special gift. So if they email me and just say, hey, I heard you, on this amazing podcast that Dr. Fong does, I will send a couple of worksheets to them. I've got a couple of, like we said, skills-based worksheets that help. It's called Wise Mind. It's one of the DBT ones, and it talks about that mind-body connection. And the idea is they can do it on their own. They can do it with their therapist, or they can take it to you and say, hey, this is what I've come up with, and here's where I'm noticing, and just as an extra tool to take to you and work with you on it, or their doctor on it. So
great. Yeah. Well, thank you for offering that to the listeners. And I will put all of your contact information, your Instagram, your email, etc., on the description for this podcast. Joelle also did a really great PTSD video. I thought that was such a cool, just kind of educational video, that I'll also add that link in the description. You're the associate producer of the Repressive Fire video, which was a really great trailer also that I saw that you released. And yeah, so we'll put all of those links on the description if anyone wants to check those out. And yeah, I really liked that educational PTSD video. That was really great. I think it gives a really good pictorial of what PTSD is. And I think some of us not even knowing that we have it.
Thank you.
All right. Well, thank you so much. And again, if you guys want to reach out to Joelle, please reach out to her. Get those DBT skills sheets. Those seem really great. I'm going to email you too, because I want some of those also. And thank you so much for joining us.
You bet. My pleasure. Thanks for having me.